Hi, I'm Andrea Crane, one of the nurses at Cynthia Gregg, MD, Face and Body Specialist. Thanks for joining today. I'd like to talk to you a little bit about a new treatment that we have called AquaGold Fine Touch. At the end of the presentation, I will be available for any questions that you might have, so jot them down. AquaGold Fine Touch is a microneedling device that delivers low-dose customized solutions to plump and rejuvenate the skin. There's 20 surgical grade stainless steel microchannels, and they're each thinner than a human hair and are 24 karat gold plated to reduce the risk of any allergic type reactions. The treatment helps to address things like dryness, fine lines, enlarged pores, overproduction of oil. It stimulates collagen. It's so many things in one little vial. It's these tiny little thin microchannels that deliver whatever blend of skin enhancement ingredients that we deem necessary for your particular skin type. It's delivered into the superficial layers of the skin of the face, neck, chest, or hands. It's the process of creating these little microchannels that not only deliver the product into the skin, but also stimulate collagen. So things that we can add into this little ampule. We can add things like Botox, Dysport, Xeomin, hyaluronic acid fillers like Belotero, Juvederm, Restylane, or serums like vitamin C. Sometimes we'll use one of those, sometimes we'll use a variety of those, depending on your skin type. Okay, this is a little video that I found that kind of shows you the ampule with the little microchannels and how it goes into the skin. It's very superficial. There's usually not even any bleeding. Sometimes there can be a little bit of pinpoint bleeding if you've got a superficial capillary, but very, very little. There's virtually no downtime to this. So those are all sterile, one-time use. Those are the little grooves that the products get attached to. And that's how we stamp into the skin. Process takes about 40 minutes, sometimes a little bit longer, depending on whether or not you want to use some topical anesthetic. So here's some frequently asked questions. Does it hurt? Well, those needles or microchannels are thinner than a human hair, so not really, but we do have the option for those people that are sensitive to wear some topical anesthetic prior to the procedure. Is there downtime? Depends on what you call downtime, but usually no. You will leave the office looking pink or red, and that usually subsides within a couple of hours. Can I wear makeup? Not that day. We want those channels to stay clean and free of anything that could potentially cause a problem. So no makeup that day. How long does it last? Usually about 3 to 4 months. Maybe a little bit less, sometimes a little bit more. I had the treatment and I would say 3 to 4 months is accurate. When do I see results? That varies. I saw results the next day. I was actually amazed by the results that I saw within a day, but that's not typical. So I would say anywhere from 3 to 7 days is a good time frame. Here are some pictures of a patient that we did before and then 2 weeks post, and you can see the reduction in redness in just 2 weeks. It's pretty amazing. And then here on the left side, you can see textural changes. So here's before and then here's after at 2 weeks. And not only is the redness improved, but texturally, that's pretty amazing for one treatment and 2 weeks post. And the next photo is of me. And you can see my most dramatic results were around the crow's feet. I thought major improvement around the crow's feet. I felt like my pores were much tighter, especially around the nose. And then I felt like pigmentation was better overall. Just the whole quality of the skin was better. And, you know, sometimes a picture doesn't show you all that, but I am probably 6 months out now post-treatment, and I still think I have some benefit to it. Okay, let's go to the next slide. Oh, I think that's it. Sorry. So if there's any questions, and I'm sure there are, I'm here. Write them down, and I'll get right back to you. All right? Take care, and thanks for joining.